Hey, everybody. Welcome to the Health Babes podcast. Today we have Dr. Nicole Beurkens. She is amazing. She talked about children and their mental health. She talked about the role that parents play in supporting the mental health of their children, what components of mental health or treatment can be overlooked, what nutrients are really important when supporting someone's mental health, and how diet, sleep, and stress play a major role. Hi, there's my child. With children's mental health. So let's get started.
So we're going to be talking a lot today about holistic mental health for children. So let's dive in. We have Dr. Nicole here. So what is the role that parents play in supporting the mental health of their children? Can we dive into a little bit of that?
Yeah, we'll just get started with a really, really in-depth question. Yes. I mean, the short answer is parents play a large role in supporting the mental health of kids. And we can get into all the detailed ways of that. But I think, to best address that question, I would want to back up a little bit and frame for everybody what we're really talking about with mental health for kids and adults. Because mental health is a big issue right now, especially for everybody across the board. And I think there's a lot of misconceptions, a lot of misunderstandings about what does mental health even mean? What does it mean for me or for my child to have a mental health issue or mental illness? And so I think I like to give people maybe a bit of a different framework than to think about this than what they have known before. And that is really to think about our mental health or our mental wellness on a spectrum. Mm-hmm. We all exist on the mental wellness spectrum. At one end of that spectrum, we have sort of ideal mental health and wellness when we or our children are feeling well, functioning well, have regulated emotions and behaviors, are just managing life well and feeling good about things.
Yeah.
On the other end of the spectrum, we have more of what people tend to conceptualize as mental illness, where we are not feeling as well. We are not functioning well. Maybe our children aren't functioning well. We have lots of those symptoms that fall in the categories of diagnosis that, some people end up with a mental health diagnosis. So those are the ends of the spectrum. And then we have everything in between, which is actually where most of us and our children fall most of the time. Somewhere not on the ideal end and not on the really problematic, symptomatic end, but somewhere in between where we're feeling good some of the time, we're managing things well some of the time, we're struggling some of the time. And I think that is a much more helpful way for parents in particular, for themselves and their children to understand this, because unfortunately we have this model in society where we think about there's a category of people who are mentally healthy, and then there's a category of people with mental illness. Mm-hmm. And that actually is completely wrong. And I understand why we've evolved to that way of thinking, because in our fields of medicine and mental health, that's how we've divided it up. We've created a very artificial system where there's the idea that, physical health and mental health are separate. And, so we think about this idea of, there's certain people who have this thing called mental illness, who have a diagnosis. But in reality, we all have the potential to be mentally well. We also, every single one of us, has the potential to be mentally ill, to have some type of mental illness. And most of the time, we're somewhere in between there, trying to live our lives, trying to do the best we can. Our kids are doing the best they can. So I just think that is a more helpful way to frame this. And so the question then around how do parents influence that? Well, if our goal is to help our children be more on or moving towards or existing in that mentally well, mentally healthier end of that spectrum, which does not mean that they're doing great with everything all the time or feeling happy or good about everything all the time, because that's not real life. No. But if we want to help them be more on that end of that spectrum, then there are lots of things that we can control both within ourselves, in our communication, in our relationship, and our behavior with our children, as well as the food that we're providing them, the stress level in the home, the expectations that we are setting, and the structure we're implementing around things like sleep and movement and education and all of these pieces. So really, parents play a critical role. Now, obviously, for any of us, and this includes kids, there are other factors. People, when I talk about this, people instantly will jump in with, well, what about genetics? Mental health problems are well, look, just like I'm sure you have talked about with many other conditions and issues on your show, we have a much better understanding now that, yes, we can be genetically prone to lots of different things. Mental health conditions are one of those things. But that doesn't mean that we are destined to exhibit the symptoms, or that just because we're having symptoms now that we can't change that or move that in a more positive direction. And ultimately, that's really hopeful, because if you're a parent who's listening to this and you've been diagnosed with a mental health condition, or your child has some sort of neurodevelopmental or mental health kind of issue, they're not destined to exhibit those symptoms for the rest of their life. They're not destined to have functional problems for the rest of their life. It's a component about them. We can know that somebody may be predisposed to something via family history or genetics, and still all of those pieces that we contribute as their parents, as the environment that we're creating around them, play a big role in whether those genetics end up being expressed or not. And to me, that's the incredibly hopeful part of all of this.
Right. You're not destined for that, right? Especially if you put the proper tools in place for yourself.
Absolutely. And I think most people don't realize that. And especially in the conversation that's happening nationally or even globally right now around mental health. It's interesting because those of us who have been in the field for a while saw all of this coming. This is not a surprise that we suddenly have, the most recent stats show that 75% of children and adults endorse some level of mental health concern, some type of symptomology right now. And there's a lot of pontificating about that, and a lot of media exposure, and a lot of experts, sort of running around like chickens with their heads cut off going, the sky is falling, everybody's mentally ill, what are we going to do? And, those of us who've been in the field for a while are like, first of all, the data's been showing, and our experience with patients has been showing now for the better part of 2 decades that these issues, these symptoms have been on the rise. We know that, especially when we look at the data with children. Over the last 20 years, we've seen an exponential increase in rates of things like ADHD, autism spectrum disorders, learning disabilities, childhood bipolar, anxiety, depression, you name it. Those things have been on the rise. Well, you throw in what's gone on in the world in the last 2.5 years, and you add that into a population of people, adults and children, who already were struggling under the pressures of modern life, were struggling more with things. And of course, you're going to get a very large percentage of the population struggling. But the typical narrative around that of, oh my goodness, look, 75% of the population is mentally ill. That's a really that's a tragic statistic and a really negative way to look at it if you don't have an understanding that actually, of course, kids are struggling more right now. Of course, parents and adults are struggling. It would actually be weird if they weren't.
Yeah.
And so when you have that perspective and you don't view it as these artificial categories of, well, now we have, 3/4 of the population mentally ill, nothing to be done about that. Gosh, I hope our prescriptions for Zoloft and Ritalin don't run out. And, there's not enough therapists, so good luck to everyone. When you look at it that way, it's very doom and gloom. But when you have this more holistic, grounded understanding of why human beings struggle with these things in the first place and all the things that we can do to implement it, it actually is not as tragic as it appears. And as parents, we play a big role in implementing things and structuring things and relating to our kids in ways that can absolutely move them from that more difficult symptomatic end of that spectrum to a happier, healthy end of that spectrum. And that, if people take one thing away from this conversation, I hope it's that they understand that is completely possible. And you just need to understand, some of the tools to be able to do that.
So what do you think are some important components of mental health treatment or support that get overlooked?
Yeah. Almost everything that's actually helpful for people in the long term gets overlooked, which I know the two of you see in so many aspects of functional medicine too.
Yeah.
I will say, just as a disclaimer, the mainstream approach, the standard of care in mental health for children and adults consists of two things. It consists of some sort of talk, cognitive, behavioral type of therapy, more behavioral for younger children and more talk therapy, cognitive therapy for older children and adults. And it consists of psychiatric medication. Mm-hmm. Those are the two mainstays of the traditional approach to treatment for mental health. And those things help some people. I do therapy as part of my work for a living. Absolutely. Cognitive behavior therapy, all different forms of therapy, talk therapy, parent therapy. We've all different therapeutic approaches in the realm of psychology and mental health that absolutely do provide support and help for people. If I didn't believe that, I wouldn't do it every day. Right. Do they help everybody? And do they help to the extent where we can fully reduce or remove symptoms? Not most of the time, depending on the issues. The same goes for psychotropic medications, for psychiatric drugs. Do they help some people? Absolutely they do. Do they help most people in the long term? The data shows that they don't. So I'm certainly not opposed to psychiatric medication. I think that it can play a life-saving role for a small percentage of people, children and adults. And I think that there are kids and adults who benefit in the short term from some of those medications, depending on their issues. But the narrative that the way that we treat depression, anxiety, bipolar, schizophrenia, ADHD, autism, whatever, in children and adults is just with those two things, the data doesn't support that. And what we've actually seen is more and more studies that come out about that on larger and larger populations show they provide some help to people. But over the long term, most people continue to struggle. And so it begs the question, what else do we need to be doing here? So if you're listening, whether you are, in support of taking medication or opposed to it, in support of therapy or opposed to it, doesn't matter. There are lots of options here. And even if you are going to utilize more of those mainstream types of treatments, there are other pieces. And the pieces that really get overlooked are the pieces around nutrition. Oh, yeah. What are we putting in our bodies, in our children's bodies, to actually provide the building blocks that allow for human brains and bodies to function properly? That, by and large, the nutrition piece has been really left out of in conversation.
Oh, true.
I mean, health in general, right? I mean, you look at it even from the medicine and the physiological angle, and you go, how is it that nutrition isn't like the foundation of what we do there? But it's not. And it certainly isn't in mental health. Now, I will say there's a shift happening there. 10 years ago, when people like me would talk about the importance of amino acids for brain function, like, hey, what you eat or what you feed your kids probably hasn't it, people would look like you had 6 heads. Like, I mean, our professional colleagues would, just ostracize us, whatever. Now that is shifting. We have some organizations and, some things moving in the direction of recognizing that. We're a long way off from that being mainstream, but of course that needs to be mainstream because it's just a scientific fact that what you put in your body allows your brain and your neurochemistry to function better or worse. And when we're talking about mental health, that plays, that has a big impact. So the nutrition piece is big. The other pieces that fall more in that lifestyle category, sleep is a very under-recognized, under-addressed piece in mental health. And yet we have all kinds of scientific research in populations of children and adults showing that quantity and quality of sleep make a profound difference in people's mental functioning. One of my favorites is when we look at children, and 10 to 12% of US school-aged children now are diagnosed or medicated for ADHD symptoms. 10 to 12%, that's a large number of kids. And when we look at the data on sleep, there have been several studies done recently that have shown that anywhere from 25 to 40% of children diagnosed with ADHD actually have an undiagnosed and untreated sleep disorder or sleep.
Wow.
And when we identify and properly treat or address that sleep issue, guess what happens? Their ADHD symptoms either dramatically reduce or fully resolve. That is really powerful data showing us the impact of sleep on developing brains, on the behavior and cognitive capabilities of children. And we have data related to sleep for virtually every mental health diagnosis, in adults as well. The number of adults diagnosed with depression, particularly recurrent, intractable, more moderate to severe depression, sleep is a huge factor there. And when we can properly address the sleep issues, the depression symptoms resolve or even go away depending on the person. So sleep is a big one. Obviously movement and exercise, which I know, people don't want to hear any more about that. But the reality is exercise is on par with or outperforms many classes of psychiatric drugs for many mental health conditions in children and adults. Again, whether we're looking at things like depression and anxiety, or we're looking at more serious mental illness issues like schizophrenia, like bipolar disorder. In children, if we're looking at things like learning issues, behavior problems, ADHD, autism spectrum disorder, it almost doesn't matter what diagnosis you pick. There's data showing that consistent, moderate levels of physical activity / exercise, I tend not to use that E word because people get really, distressed about that movement. I call it movement. Moving your body has a big impact on your brain's ability to function and on your mental health. And then obviously stress is the other big lifestyle category. And is it a wonder? Most people are struggling with some aspect of their mental health. People endorse stress levels that are off the charts. There was a recent study done with teens. The American Psychological Association does a report every year, sort of their monitor on stress levels in America. And so this was from the data that they collected 2 years ago. So it was just right at the start of the pandemic. The pandemic hadn't even really taken hold yet. And what they found is that teens in the United States endorse stress levels for themselves in today's world on par with what 40-year-old middle-aged working men and women endorsed as their stress level 50 years ago.
Wow.
Now you think about that and you go, what in the world are we doing? What kind of a culture, a society, a world have we created for ourselves and for our children that our teenagers are as stressed today as middle-aged working adults and parents were 50 years ago? Like, we've gotten off on some kind of wrong trajectory here. So stress is a huge issue, and for adults too. And obviously, as you know, as your listeners know, stress plays a role in virtually every chronic disease.
I know.
Whether you want to call it medical or mental health, unmanaged, chronically high levels of stress are really problematic. So, and yet these are the pieces that to us makes so much sense. It's like, well, duh, of course. And yet the majority of people are out there meeting with practitioners and trying to address their issues, not understanding or recognizing any of these factors, and then wondering why their kids aren't getting better or wondering why they aren't getting better. These are the overlooked pieces that until we start to prioritize these as the foundation of mental health and mental wellness, we're going to keep struggling with helping people to get better.
Do you
Don't
think,
you-
oh, sorry, Beck.
Sorry. I was just going to say real quick, what do you think about the screens?
That's what I was going to say.
Really?
You're right on target, girl.
You're so insane.
Same wavelength, absolutely. And, this is a big factor, and the data bears this out, for as many positive things as technology, social media, screen time have brought into our lives and into the lives of our kids. There are also a lot of problems and a lot of detrimental effects. And again, it's the unpleasant truth about this. And parents will often get real defensive and go, don't talk to me about, screen time. I have enough to manage. Like, I need my kid to watch their iPad. And it's like, I hear that. And at the same time, you're in my office.
Right.
Because your kid isn't sleeping. Your kid's so impulsive and hyperactive that they are creating problems everywhere they go. The teacher is saying your kid's not learning. So we're going to have a conversation about something's going to have to give here, right? And if your kid is spending 8, 10, 15 hours a day in front of screens, the clear research is that's not good for their brain.
No, their cortisol goes up and their melatonin goes down.
Exactly. And some kids have sensitive brains. Parents will say, well, don't, screen time didn't cause my kids ADHD. Well, probably not. Although, have I seen cases where kids have been diagnosed with ADHD? We change these lifestyle pieces, including getting a handle on their screen time, and they don't have ADHD symptoms anymore? Absolutely. But for kids with more genetically prone sort of classic ADHD, no, screen time didn't cause your ADHD.
Right.
However, screen time, depending on how you're using it, may be exacerbating your kid's symptoms and making it a lot harder for them to function. So we have to look at this. And actually, there are 3 areas that the research shows screen time most negatively impacts kids' brain function and mental health. The first is that time on screens displaces time spent on other things that are supportive of their development and their well-being. In other words, when they're on screens, they're not outside riding their bike or moving their body. When they're on screens, they're not interacting, communicating, and engaging in real life with other human beings. When they're on screens, they're not using their brain to come up with ideas of what they can do or how they can spend their time. And those other activities are very important for supporting brain growth and development in children and allowing their brains to learn how to function properly. So that's one of the problems. The other problem is that some kids have very sensitive brains where the more time they spend on screens, the more trouble they have with things like sleep, regulating their emotions and behaviors, managing their impulsivity, those things. And then we've got the piece of what they're actually spending time doing on their devices. And the data is pretty clear now that excessive amounts of time spent on things like scrolling social media, more passive activities leads to more detrimental issues with the brain. So those are the areas where we see the impacts. And so, it's important for parents to understand that piece. And the solution is not to take these things away from kids. I am a big proponent of helping kids learn how to have technology and devices be part of their life in a healthy way. And I think the challenge for that, and where we have so much defensiveness around that as parents, is because we're still trying to figure that out.
Isn't that the truth, though?
We are the first generation of parents having to deal with this. My kids are older now. My kids are 15 to 22. So I can say even over the course of my 22-year parenting journey, this has shifted. When my kids were little, everybody having tablets still wasn't a thing. There wasn't nearly the amount of stuff. But now I absolutely deal with that with my teens, with my teenagers at home. And the world just is changing rapidly in that way. And we are trying to figure out how to regulate our use of things like social media, gaming, all of the access that we have through our devices. And then we're also supposed to be figuring this out for our children. And we don't have models for that. It's not like we can call our mom and go, yeah, hey, so how did you handle that? Or we can reflect back on our own childhood and go, oh, well, this is how my parents did it.
Exactly.
I didn't have a cell phone until I was an adult. I mean,
Same.
so we're trying to figure this out for ourselves. At the same time, we're trying to guide our kids, and the data shows, and just the anecdotal piece of like what I'm seeing in the clinic day in and day out, we're not doing a real great job about that. But we need to have it on a radar. And just like anything else, the goal is not perfection. The goal is that we're aware of these factors and that we're just willing to take some steps, however imperfect they may be.
Right. And you got to think too, like for trying to find balance with all of this, even schools, it's like technology and screens, schools are brain. So it's the way the world is going. So having to find that balance has been so tough, I feel, for parents, everybody.
Well, for sure. And that's why, the way that the recommendations used to be, like the American Pediatric Association is the one that has had the longest running set of guidelines for parents. But, when they first came out with those in, I don't know, it was probably like 2008, 2010, something like that, the recommendations were like, school age children shouldn't spend more than 2 hours a day on screens. Okay. Well, fast forward to now, kids get to lunch during their school day and have already spent more than 2 hours on screen. So that old way of thinking about it in terms of time limits no longer applies, except when we're talking about young ones. And the recommendations still are very, very clear around young children and the amount of time. But once they get to be school age, really what we need to be thinking about is, what are the priorities? What do kids need to be doing in their day to support their development, their learning, their mental health, their physical health? And how do we structure things so that screens take a back seat to those priorities and screens become something that you do with the rest of your time? And that's really how we help families to think about creating balance, not so much in this micromanaging, like, well, you already spent 45 minutes on this or whatever, but more around, okay, you're asking for gaming time or screen time. Have you moved your body today? Did you get your chores? Have you done an extracurricular? Like, what have you already done with your day and your life? And then, where are we going to plug screens in? And that becomes a much more effective way to think about that.
Yeah.
I love that. Yeah, that's really good.
So let's talk a little bit about nutrients to improve irritability in kids, if you don't mind sharing that, because we see this a lot, even in practice.
Yeah. Well, kids are irritable, sometimes because of the developmental stage they're in. I mean, if you've ever lived with a teenager, that, or a toddler for that matter. So there's irritability and then there's irritability, right? And some of you listening are dealing with kids where their irritability is really getting in the way of life functioning. It's getting in the way of relationships and all of that. But there are nutrients that are really important and foundational for supporting kids' brains across the board, irritability included. And then there's a few, specifically to think about for more irritable or like behavioral kinds of. But in general, I think about focusing on food and broad nutrition first. Like, people often say to me, like, what's the supplement I can give my kids so they won't be so moody? And it's like, well, let's talk about the context. Yeah. Because I can give you research-based recommendations around things like fish oil, magnesium, vitamin D, and none of that really is going to make a difference for you or your kid if your child's diet consists of Pepsi, Twinkies, and Fruit Loops. Like, I can't help you.
Amen to that, because so many people want that quick fix, which is why they don't like when you tell them not to use the screens.
Right.
And they're not willing to put the diet piece in. They just want the supplement piece, or, and it's all goes together. You have to, it's a puzzle. It's all pieces in the puzzle.
Parents who say, I don't want to put my kids on medications. I say, okay, I understand that. And then they say, but just tell me the pill to get, just tell me the supplement to give it. It's like, well, that's the same approach, that's still approaching it as if there is a magic bullet, a pill Band-Aid, something. I will say, is it possible to not change a child's diet and to use very specific, targeted, therapeutically dosed supplementation to support symptom improvement? Yes. Do I sometimes have to do that? Yes, especially in the context of children with extreme picky eating or feeding disorders, which is unfortunately a growing number of kids, where changing their diet, at least initially, is not going to happen. So we need to, so I don't want, if you're out there as a parent listening to this and you're like, well, now there's no hope because I can't change my kid's diet. Right. Look, we absolutely can use targeted supplementation at therapeutic doses, sometimes even to address the reasons why they have extreme picky eating in the first place. But in general, if you're just looking at, it's really just hard to change my family's diet. It's hard to get my kid to eat anything besides pizza and macaroni and cheese. So just tell me to supplement. You're not going to get as great of results because we can never mimic via supplementation the full complement of vitamins, minerals, phytonutrients, antioxidants, all of the things that are that exist in actual food. And so when we're talking about the nutrition piece, really, the preferred way to think about it is building a foundation of more nutrient-dense eating first, which may mean initially just some simple swaps around, we're going to get rid of, over time, you can cold turkey it if you want to, or you do it over time, the sodas, the fruit juices, the sports drinks, the sugary drinks, the chemical-laden drinks, and we're going to put water in as the primary beverage. It may mean things like we're going to start looking at all of the packaged snacks and things that we're feeding our kids on a day-to-day basis. We're going to look at how many grams of added sugar are in there, and we're going to go to the store and look for some swaps of similar things with less added sugar. We're going to start putting fruits and veggies out as options for, morning and afternoon snack. There are ways to slowly and consistently move towards a more nutrient-dense diet, which just means your kids are getting more of those nutrients, the building blocks their brain needs and their body needs to function well. And protein is a big one there. And I think people, especially when we're talking about mental health, they don't understand this. So let me frame it in a way, just with what lots of people have heard around mental health. If you've heard of medications like SSRIs for depression or anxiety, or even things like stimulants for ADHD, you may be aware that the reason we think those medications work, we actually don't know, is that they play a role in impacting amounts of specific neurotransmitters or brain chemicals like serotonin that allows us to have more pleasant regulated mood, like dopamine that allows us to stay more focused and attentive. So that's the idea behind those medications. But what those neurochemicals, those neurotransmitters like serotonin, dopamine, norepinephrine, all of those are made out of is amino acids. Our body produces them. Where do amino acids come from? Proteins. So if your child is not eating a diet with sufficient amounts of protein, and they're not able to break those proteins down well in their digestive system, they literally do not have the building blocks, the pieces that their brain and body needs to make things like serotonin, dopamine, norepinephrine. And of course, that's going to impact how they feel and how their brain functions. So that's just like a little overview of that, because sometimes I think people are very familiar with the idea of nutrition and quote unquote healthier eating as being important for their physical health. They equate that to weight and things like diabetes or heart disease or whatever. It is equally important for our mental health. And I think explaining some of that of why. So the protein piece is important. A lot of kids are eating diets very high in carbs and sugars. Yep. In fact, the most recent data that came out about children in the US, at least, it was data collected about 18 months ago, showed that now in America, the average child 68% of their dietary intake is from ultra processed foods. 68%. And an ultra processed food is a food that is not nutrient dense. It's a food that has a lot of chemical additives, has a lot of added sugars. It is not focused on nutrients. And so if 68% of a child's diet is comprised of non-nutrient dense foods, we're going to have a problem. So if your child is irritable, if your child is struggling with attention, with their mood, if they're anxious, if they're just not learning well, whatever it might be, start with looking at how to improve the nutrient density of their diet. Some of those tips that I mentioned, water, reducing added sugar. Real important tip for children and teens, give them a good dose of protein in the morning. Breakfast, real important. We talk a lot in the adult world about intermittent fasting and all kinds of, that's for the adult world. Children are not miniature adults. Children need to be eating throughout the day. And one of the best ways you can set them up for steady, positive mood, focus, managing that irritability and that anxiety is give them a good amount of protein in the morning.
Yeah.
That sets them up for having the building blocks that their brain needs throughout the day. So we start with food intake, and then from a targeted nutrient standpoint, I'm a fan for most kids of a good quality, well-dosed multivitamin. Kids have such gaps in their diet. Rarely do I do an intake in my clinic on a child or a young adult where even the basics are being covered through their food intake. So while we're shifting their food intake, I will put them on a good quality, well-dosed multivitamin to at least get the basics of their nutrient requirements covered. And then the other pieces from a mental health standpoint, whether we're talking about like irritability or anger issues or behavioral dysregulation, anxiety, those types of things, there's a few that stand out. Magnesium's a big one. Magnesium plays a role in hundreds of cycles and processes in the brain and body. Magnesium is very good for smoothing out irritability and anxiety, for supporting restfulness and sleep, depending on when you give it and how it's dosed. And most people are not getting enough magnesium, even in the best, quote unquote, healthy diet. So I use magnesium therapeutically very often in children, teens, and young adults. Vitamin D levels tend to be quite low, suboptimal, or even deficient in children. We know from the data that vitamin D is another one that plays an important role in mental health. Have your child's vitamin D status checked. If it's suboptimal or clinically deficient, use supplementation to get that up. Omega-3s in the form of fish oil are one of the areas in the nutrition research literature that we have the most evidence related to things in mental health for kids and adults. So improving that ratio of omega-3 fats that the brain needs to the omega-6 fats that most kids are getting through their processed diets. Now, a lot of times people will say, oh, fish oil, like I remember my mom chasing me around like with cod liver oil or whatever. I'm never going to get my kid to take that. The good news is we have lots of options for that now. We have capsule products, we have chew products, we have liquids that are not smelling and tasting like what you remember from your childhood, but the data is really good. For kids through young adults, whether we're talking about things like ADHD or irritability and behavior issues, depression, bipolar kinds of presentations, the data is really good that giving higher dose, therapeutic doses of fish oil, particularly with a heavier emphasis on the DHA, but a DHA and EPA blend, can lead to anywhere from mild to significant symptom reduction. Yeah. And so, you look at how you can incorporate that into the mix. So those are some of the big ones. The other two that I'll just mention, because it's such low hanging fruit that just doesn't get addressed. If your kid's struggling in any of these areas, ask your child's primary care provider to run an iron panel on them. You would not believe the number of children we see in my clinic on a weekly basis who have years of history now of dealing with chronic, serious mental health issues, behaviors, whatever. And it turns out they're anemic.
Yeah.
And no one ever looked at that. Well, what you need to understand if you're listening to this is that iron plays a critical role in brain development, in processing in the brain for children. It's important for adults too, but for children, even mild to moderate chronic deficiencies literally lead to cognitive impairment for kids.
Wow.
And this goes undiagnosed. And so it's as simple as having a lab test done to see, is your child's iron level? And not just, don't just ask for, well, what's my kid's iron level?
Yeah.
There's a panel there that you want to look at to see what is my child's iron status, because often supporting, boosting that child's iron status, even if they're not frankly anemic, even if they have suboptimal levels, there's data to support that improving iron status is helpful for these things. Real low-hanging fruit, because guess what? If your kid's having an issue there, we can tweak their diet and or give them iron supplementation to help bring that up. And it only takes a few weeks really to see some improvement there. So that's one, and the other is zinc. We're seeing a lot more kids coming in with suboptimal or deficient zinc levels. Mm-hmm. Some of the ways that manifests in kids that often are surprising to people, that I think even most people in the medical profession aren't aware of, kids with sensory processing issues. Zinc plays a key role there. So if you have a kid with sensory processing issues, if you have a kid with picky eating, zinc plays a big role there. Zinc also, we see more and more data coming out about the role that proper zinc levels play in the full range of mental health issues, whether we're looking at anxiety, depression, we're looking at things like autism spectrum disorders, ADHD. So zinc can be a helpful piece to look at there as well. The B vitamins are another one, lots of data, particularly around, B6 and B12, but also B9, our folate, more and more data coming out about B1 and B3. So clearly the B vitamins are important. And sometimes some targeted supplementation of either a B complex or one specific B vitamin, can be helpful. That I tend to prefer to do, in a targeted way with a healthcare practitioner looking at that, because you can also overactivate a kid pretty quickly by just, hey, I read B vitamins are good, so I started giving my kid a B complex, and guess what? He hasn't slept in 3 weeks, and he's bouncing off the walls, and he's super irritable. You go, well, that's not a good idea. But I think just to spotlight some of the key players, and this is not my opinion, that there is research data on all of this. The reason why I think so many people in the general population, and even within the fields of medicine and mental health, still think that this is fringe or, shouldn't be a standard of care, is because they are unaware of the large body of scientific research around these things. It's not an idea, it's not an opinion. And honestly, for those of you who feel skeptical about this, I was too. I was very traditionally trained. I went through a very traditional clinical psychology PhD program. None of what I'm talking to you about today was part of my academic training, was part of my pre or postdoctoral training. This is all research and information and further study that I've done over 25 years of being in the field and getting to a certain point and realizing, wait a minute, the tools that I have in the realm of child development, behavior, clinical assessment and intervention from the educational and psychology realms of things are helpful, but they're not the full picture.
Yeah.
And it was getting curious about that, not only for my patients, but also for 2 of my own children at home, that led me down the path of really delving into the research and the practice on this, and going on and getting an additional degree in nutrition and becoming board certified. But I was skeptical too, because this wasn't part of what I was taught. about mental health, about how you assess or treat mental health. So if this sounds weird to you, if this is new, if you're like, I don't know if that can be true, I get it. And I would just encourage you to continue to explore it, because the things that we're talking about today, they're not opinion. They're scientific fact. They're grounded in the research literature. And thankfully, we have more and more studies being done every day on specific mental health presentations and symptoms, and specific nutrients, ways of eating, whatever, because we need additional tools. It's very clear that the old standard of cognitive behavior therapy and psychiatric medication are not getting people where they deserve to be in their life and with their symptoms. So we have to look at these other pieces, and nutrition is obviously a big piece of that.
Yeah. I think it's really important too, to note, going back to the nutrients that you listed, especially with iron and vitamin D, and the B's, you said, don't just give this to your kids, because especially like iron, you could have, iron overload, and that, runs in your family, and then you're giving your child more iron. Don't do that. Number two is with the different forms of the vitamins, there's a lot of gummies out there, and those gummies are sugar mostly. Right. So just be careful, what you're giving them. And, if you're working with a practitioner, they probably know the right stuff. And there's a lot of things we don't want in our vitamins as well as what we do want. So just kind of a side note, I wanted to make a little point there.
Yeah, absolutely. And that's why I say to people, especially where iron is concerned, you need to test for that, because in young children, especially, you can easily overdose them, and that is not good. And so you need to know where their levels are. And it's interesting, to your point about the gummies. Yeah, I mean, it's amazing to me how many parents just have a really firmly held belief that their kids can't learn to swallow pills.
Yes.
The reality is that even preschoolers have the physiological mechanisms in place to be able to learn to do that. It is a skill that we need to teach. But the number of teens and young adults, even adults that we see in our practice, are like, oh, no, I don't swallow pills. And I'm like, well, let's teach you. It's time for you to learn. Yeah. Because to your point about the gummies, it's just really extra sugar. The nutrient forms usually aren't very absorbable. Right. And then you run into the issue of people coming in and saying, well, yeah, I've done that. I tried the nutrients thing and it didn't make a difference. And it's like, well, what were you giving and how much? Because there are therapeutic dosing ranges for these things.
Yes.
So if you're giving your kid a Flintstones chewable and saying, well, I tried the nutrition thing, I'm sorry, but you haven't. And so, your point about understanding quality and amount, like all of those pieces are really key.
Yeah, I've taught my kids to swallow vitamins since they were about 5. I mean, all my kids had the white, the zinc, the zinc deficiency that shows up on your fingernails. If you see the white little spot on your kid's fingernails, they're usually zinc deficient. And I don't know, I didn't know of a good form of that other than swallowing it. Luckily, they're small capsules, but they all take it. So
they build up anxiety, and you start little. If you have a kid, we have some kids who have pill phobias, pill swallowing phobias. Back years ago when I was doing work in a pediatric inpatient hospital setting, we did this work all the time because there were children who needed life-saving medications and needed to, do that daily, that we had to teach them to swallow. Yeah. And so you don't start with the big omega pill or even the magnesium capsule. You start sometimes like with, a tiny little, chocolate chip, or you start with a tiny sprinkle. Luckily they make ones that don't have the artificial dyes now. That's my preference. You start with something imperceptibly small, and you say, well, of course that went down like that, but here's what it did. It helped with that anxiety loop of showing them, here's the process. I can do it. And for kids who truly have phobias, there are protocols that we use to help them with that. But it's amazing. Usually the block of why children aren't swallowing pills is the parent. Yeah. And so when we expect our kids, we say, well, yeah, you can learn to do this. We're going to practice. You might not get it right away, but they do learn to do it. And that makes everybody's life easier for sure.
And you're showing, like, when I taught my kids, I acted like it was no big deal. I didn't say, okay, we're going to learn to swallow today. Like I was just like, all right, take this, put it in the back of your throat. We're going to do water. Watch me do it. Okay. Now you do it. And it was like, oh,
Right.
there was no fear because I didn't seem like it was anything to be fearful of. I think that can be helpful too.
Well, and I think that's a really important point around, something we haven't touched on, but is probably worth mentioning here, which is one of the roles that we play as parents in our kids' mental health is via our own emotional and behavioral regulation. Mm-hmm. And a surefire way to have an anxious kid is for us to ooze our anxieties all over them all day long.
Yeah, so true.
If you want a recipe for that, you be an anxious, distressed, hypervigilant, adult in their living environment, guiding them, parenting them, and you'll have a kid who ends up with anxiety as well. Now, I'm not blaming parents. This is just part of how it works. A parent who's depressed, we've got data on depressed moms and the impact that has, particularly during the birth to 5 years. Now, it's not a mother's fault that she has depression, but we do need to understand the roles and the cycles and the bi-directional impact that has. Our kids, their mood, their behavior, their anxiety impacts us, but our mood, our anxiety, our behavior impacts them. And so one of the foundational things when we're working with families where there's one or more kids with challenges is actually doing a lot more work initially on the parent side of things. Yeah. Not because parents are to blame or are causing their child's symptoms, but because the only thing we actually can control is ourselves.
Yeah.
You actually can't control your child as much as you want to think you can. You actually cannot. Yeah. And so we have to focus on ourselves and being more aware of our patterns and the dysregulation that we bring. What are our interactions like? What's our communication like? How is our emotional experience and then our behavioral reactions impacting our kid? And then how are they responding to that? So that's a big piece, whether we're talking about a child who, is resistive or afraid of swallowing pills, or a kid who's fighting about food that's offered at the dinner table, or a child who's super anxious about leaving the house, or a kid who's throwing temper tantrums about everything, like whatever it might be, we play a role in how we bring ourselves to those interactions with our kids, how we are able to stay calm or not, how we are able to communicate effectively or not, how we are able to manage our behaviors or not makes a huge difference, not only in how those interactions go, but also in our kids then being able to form the brain connections for regulating their emotions and behaviors in more effective ways. So this is a big, big piece of it. Yes to the diet and the supplements, yes to all the lifestyle factors, but also yes to us learning more about ourselves, working on the things we need to work on, and understanding how to bring ourselves to the parent-child relationship in a more effective way.
So true. I grew up with a very nervous mother. And I was a nervous kid. I watched her, be nervous about everything. And she's like, that's just how she is. She's still like that. But then I almost became like the opposite, where I was like pushing boundaries all the time because I didn't want to be in that nervous box, And so I've learned with my own kids not to be that way and to not, just to be relaxed around them and to talk to them and to let them express themselves for who they are and, that type of stuff. And I think you emulate or you change, kind of what you see. And I hope it makes a change. And I hope my kids don't suffer with anxiety the way that I did, because it's still with me. I still work through anxieties because of what was kind of ingrained in me in such a young age growing up.
Yeah. There's a lot of talk out there now, especially on social media, about being a cycle breaker, breaking these intergenerational patterns. And, that's really what we're getting at here, right? Is we can recognize that our parents did the best they could. Mm-hmm. Yep. we're doing the best we can as parents.
Yeah.
Look, people say, well, how do I make sure my kid ends up okay? It's like your kids are going to have issues. All of our kids are like, you don't live a normal human existence without having issues at some point. So, maybe this is relieving for some of you to hear, but if you're a parent, inevitably you have already screwed up. You will continue to screw up in some way. And that's just how it is.
I love that.
Empathy for ourselves. We can have empathy for our parents, for our grandparents. We're all doing the best we can. Where this cycle breaking idea comes in is becoming aware of some of those patterns.
Right.
Like you just so beautifully shared, like you, as you became an adult, became aware of, oh, I see this in a new way. Because I bet your mom's mom was the same way, right?
And she was a greater degree and my mom was a lesser degree.
That's right. And so you were like, oh, I see this in a different way now. And because I'm aware of it now, I can be intentional about choosing to do some things differently with my kids. The problem is most people recreate those cycles of what they experienced as children with their parents. They just recreate them because they're not consciously aware of them. So this idea of what do we need to become aware of and work on for ourselves? What patterns can we start to become aware of and say, oh, boy, I swore as a kid that those things that came out of my dad's mouth would never come out of my mouth. And now, wow, I'm finding I'm reacting to my kids in the same way. I don't want to be like that. I know what that did to me. I need to figure out for myself how to change that. Guess what? That's not anything your kid is doing or not doing. That's work for you to do on yourself. And so I think very often when we're talking about kids, particularly when we're talking about kids who are exhibiting challenges, whether it's intense behavior challenges, whether it's diagnosed challenges, the focus is on the child. What is wrong with them? What needs to be fixed for them? It's very short-sighted and actually inaccurate. And I'm not saying there's never any targeted work that needs to be done intrinsically for the child, but the vast majority of the time, what the child is responding to is the people and things and situations in the environment around them. Right. And that stuff we actually have a lot of control over. We have control over changing our anger level, for example, when we are frustrated with and engaging with our child. We have control over not bringing our chronic anxiety into every interaction with our kids. We have control over setting the pace and structure of our daily schedule and our family life. We have control over the food that we bring into the home. We have control over whether we allow the school to force our kid to do 5 hours a night of homework or not. We have control over whether we shut the internet off at 10 o'clock at night because everybody in this house needs to sleep. We have control over a lot of things. So this idea that if a child is struggling and having problems, it's something the child needs to fix. No, it's actually, we need to start with all of the pieces that we have control over. And then once we've done that, if we are still having some issues, then we look at maybe where we can shape and shift and get the child engaged and changing some things on their end. But we have to start with all of the pieces on our side of the equation first.
Yeah, I love that. That is so true. Like, look at the environment first that the child is in, and then start working on actually the child.
Yeah.
So with that in mind, so what, we focus on so many things we can do as a parent that we should be doing as a parent. So what are some things that we don't have to do?
Yeah. So some things that you don't have to do. You don't have to let your kids have things and do things just because everybody else is having them.
Amen to that.
Talking about screen time, that's a big one. Parents will say, well, I felt like I had to give, my 8-year-old the iPhone because, he was coming home saying all his friends had it. Well, go back to the proverbial thing that probably all of us heard from our parents. If all your friends jumped off a bridge, would you do it too? I mean, you just go, I look at parents sometimes and I'm like, wait, you gave your kid an iPhone because his friends had it and you were worried that he'd be socially left out. Can we examine that a minute? And actually that's more about you than it is about your child. And so, we don't have to allow things or structure our lives or families or what we're doing with our kids just because that's what, other people are doing. In fact, that can be really damaging. That's how kids really get into situations that they shouldn't be in. And I'll say, in case anybody's wondering, an 8-year-old doesn't belong having a smartphone, period. With or without parental controls, an 8-year-old does not belong having a smartphone. And the sad thing is most of them are walking around out there with a smartphone with no parental controls on it.
Yeah.
Which is a whole nother episode that we could get into. But anyway, so we don't need to do things just because it seems like everybody else is doing them. If we go back to like even looking at health in this country, if we do what most people do, we will be chronically ill, period, end of the sentence. So you better start thinking about what is the better and healthier thing for you and your kids to be doing, and not just what most people are doing. So that's one thing. I think the second thing we don't need to do is run ourselves ragged, giving our kids all of the opportunities, experiences, enrolling them in all the things because we're worried that, they won't get into a good college, or they won't have explored every possible extracurricular that they could ever be interested in, or, that they'll feel like they were deprived of opportunities. You don't need to do that. And actually, some of the most intractably anxious and depressed teens that I see in my clinic are kids who have been run ragged, doing all the things, and they've not had any time to just exist, to just be, to rest, to have downtime. It's one thing after the other, and the parents are stressed out, and the kid is stressed out, and then there's the guilt tripping of, do you see all the things I do for you? And you don't, it's like, stop, pick a thing.
Yeah.
Part of this for me, like I have 4 kids, all born in a stretch of 6 years.
Right.
So for us, practically speaking, from a financial, transportation, only having 2 of us and 4 of them perspective,
yeah,
they each all the way along have been able to choose one activity, one extracurricular to pursue.
Mm-hmm.
If it's any consolation to anyone, I have 3 now in college, 1 graduating from, like, very well adjusted, doing very well. Not doing all the things throughout their childhood has not hampered them.
Yeah.
And in fact, I see the opposite happening a lot. So we don't need to do that. Do yourself and your kids a favor and just pull back and don't do all the stuff. And I guess the other thing I would say is we don't need to beat ourselves up constantly and be anxious and fearful all the time that we are not being a good enough parent.
Mm-hmm.
If you're listening to this podcast, I've never met you, and I can guarantee you are a good enough parent, because parents who truly are neglectful, abusive, truly not good parents, dangerous, damaging parents, are not listening to a show like this about how to understand mental wellness for their kids.
So
I don't even need to meet you to know. You are doing the best you can. You are doing a lot of things right for your child. Give yourself some grace. You will never be perfect. I do this work for a living and have for 25 years now. And I have messed my kids up in some ways.
Mm-hmm.
Yeah. And I give myself a lot of grace around that. We're humans.
Yeah.
We are humans. We keep learning. And as we learn, we can change, we can get better, of course, all of those things. But you have permission to stop beating yourself up and being anxious about whether you're doing okay by your kids. As I said earlier, all of our kids are going to grow up to have some challenges. That's called living a normal human life.
Yeah.
Our job is to just be the best that we can and to do the best we can with what we know at the time. And so you can stop beating yourself up about that. Those would be my things to stop doing.
That's so true. You made me a little bit emotional.
I
love my kids so much. So whenever we talk about kids, I'm just a hot mess express.
And Crystal's like the best mom. I mean, she really is just a good human in general. But so for her to get emotional about that is funny to me, because I feel like she's got it. But nobody does. I mean, that's a good point. Nobody's perfect, and we're all just trying.
Right. We all look at other people, look, she's got it all together. Like, it's a perfect thing, when you work with families for 25 years, one thing you realize is that no family has it all together. And we we see what is in front of the curtain, and you don't have to peel the curtain back much for any of us to find some things that are not so perfect, and just for us to give ourselves grace around them.
Yeah,
Yes, exactly.
it's true. And not to compare yourself. Cause like what I'm saying about Crystal is I look at her, you know, we're so close. Crystal and I talk 100 times a day and we know each other's kids and stuff. And I'm like, oh, she's such a good mom. You know, like I sometimes don't feel like I'm slacking, but
good mom.
But then someone else might look at me like that. Like, you know what I mean? It's just, yeah.
That's exactly right. And we all, you know, also, you know, you want to think about what's important for our mental wellness. It's not beating ourselves up about that. It's giving ourselves grace. It's reminding ourselves, I'm doing the best I can. And that has a very positive impact on our mental health. And then when our mental health is better, guess what? It has a positive impact on our kids' mental health.
So true. I'm telling you, like the best thing I've seen with my kids is they respond to how I'm acting.
Yeah.
Or feeling, you know, they can sense when something's off with me. And so you know, that's a huge, huge thing. And I know from seeing it with how I grew up to seeing how my kids respond to me, it's.
And actually what you just described there is the essence of the entire body of child development research and literature, which is that children develop through their relationships with key adults in their life.
Yeah.
And that's how that development happens. And so we, you know, to come full circle to the first question you asked about the role that we play the most important role because we are the key significant adult. Maybe there's a few of us in the lives of our kids, and our children literally develop in all ways, shapes, and forms through their relationship with us. And so, what you're talking about is that.
Yeah. Well, why don't you share where people can find you, your book, and all the things?
Yeah, so my website is drbeurkens.com, DRBEURKENS.com. I've got lots of resources there for you to have, download videos, audios. My podcast, The Better Behavior Show, is there. You can find it on all the major podcast players too. We've got well over 200 episodes at this point, and it's very popular with parents, whether your child is diagnosed or not diagnosed. Lots of good content there. On social media, I'm most active on Instagram. That's where my
you have an amazing account.
Thank you so much. That's where my community of people hang out, and that's where I enjoy spending time. I'm also on Facebook and some of the others, but Instagram's come join me there at Dr. Nicole Beurkens. And then my book, Life Will Get Better, which is a few years old now, but still very relevant, was my book written for parents. If you have kids struggling with any type of issue around attention, anxiety, mood, behavior, that book is sort of like a getting started manual of these different areas to address. So if you found the conversation today interesting and want to dive into those pieces more, the Life Will Get Better book is a great option. It's on my website. It's on Amazon, any of the bookstores, so you can find it there.
Awesome.
Well, thank you so much for coming on. This has been an amazing episode, and we're just so grateful to have you and, you know, this type of knowledge for people, because I think people really need to hear a lot of this.
Thank you for having me. This was fun.
Yes.
And thank you guys for listening, and don't forget to leave a review. It takes 2 seconds and it's really helpful for other people looking for what type of episodes they want to listen to. So please mention Dr. Beurkens' name in your review. And follow us on Instagram at Health Babes and on YouTube, The Health Babes. You can see this on video. So everyone have a great day, and thanks for listening.